Now, at the same time, we have so many people who are dealing with serious non-coronavirus related medical issues right now. Let's take cancer as an example. So how do they maintain treatment with all these restrictions now in place on so many medical facilities?
We're turning now to Dr. Jason McKellop. He is the medical director of Breastlink. He joins us now live via Skype. We want to thank you, Dr. McKellop, for getting up this morning and joining us today. We've got some questions. We got so many people who are dealing with cancer. They need imaging, they need x-rays, and they're at high risk. So what should they be doing now?
Absolutely. Thank you so much for having me. And it's a very important issue. I think that's one that can go overlooked amidst this crisis that's ongoing, are the medical conditions that are happening in parallel to coronavirus. Serious conditions, like you've mentioned, like cancer, that a delay in such diagnosis may have impact on morbidity and mortality that rivals coronavirus and in some instances exceed, statistically speaking, the impact of coronavirus. So the answer to that question isn't a simple one. And the best way I could answer it is that it's one that's personalized to each individual patient. We try to triage each patient on an individual basis in coordination and in concordance with the referring clinicians and referring hospitals. So we try to triage these patients based on their symptoms. Say, for instance, a 65-year-old male wakes up, looks in the mirror, and notices that his skin is yellowed or the whites of his eyes have yellowed, a condition we know as in the medical community as painless jaundice. Then this patient may require more acute imaging or medical care in order to diagnose something like pancreatic cancer, which has an extremely high mortality, as we know. If a 60-year-old woman wakes up tomorrow morning and feels a lump in her breast, that's something that requires her doctor's attention. They will hopefully write a script for a diagnostic mammogram so that she could be imaged and get appropriately timed diagnoses.
And Doc, I want to ask you to that extent then, so let's say it's something serious and people have to go in. We've heard about hospitals being short of supplies. What about, in your field? Do you have gloves? Do you have masks? What are people going to expect when they go in to get treatment?
Right. So we, of course, are going to be judiciously using PPE, these masks and gloves in the patient care setting. We try to maximize use of that when there's close contact between practitioners and patients. As you've mentioned on this hour and previously, there is a shortage nationally, and we have to be judicious about the use of it, such that when we do experience our peak here in Southern California, the people on the front lines within the hospitals can have access to that.
Okay.
Another thing that we're doing, I'm sorry.
Go ahead.
Another thing that we're doing just as a course of our imaging patients is we're offloading those hospital systems from the imaging burden that they may have. So as you may have seen in New York, they've repurposed public spaces. They have a ship parked in the Hudson that they're seeing patients that are not COVID patients. And in a similar vein, here at RadNet, we're imaging patients in coordination with hospitals that would offload the burden that they would otherwise bear in their own facilities.
Okay, you're doing a lot of good work, and it's so important. Dr. Jason McKellop, thank you so much for joining us this morning.
Thanks for having me.
We appreciate it.